While we wait for everyone, if you guys want to just put your name in the chat and what LEA organization you're from, if you can go ahead and do that. All right, we're going to go ahead and get started. So welcome everyone, and thank you for joining us today. So I don't know if any of you are new here, but last year we launched our social determinants of health webinars. And really the goal of these webinars is to raise awareness about the social determinants of health and their impact on the well-being of the whole child. Today we have Casey Triggs from California Department of Public Health, specifically from the Maternal, Child, and Adolescent Health Division, who will discuss the social determinants of health and the effects on youth well-being and academic success. I just want to give a few reminders that the webinar will be recorded and you'll have access to the slides on LiveBinder at the end of this session. And then we also ask if you guys can complete a brief survey to provide feedback, so that way we can improve and just see what other topics you guys are interested in. So with that being said, I'm going to go ahead and pass it on to Casey. Thank you.
Great. Thank you, Marwa. Well, welcome. Thank you, everybody. Good afternoon. My name is Casey, Casey Triggs, and I appreciate y'all coming in today to talk about social determinants of health and absenteeism and how that relates to the overall success of students. I'm not sure if any of you have a background in public health or have experience exploring social determinants of health, but we'll explore those today, and I'll try to make some connections on the role that social determinants of health play in school absenteeism in particular. Just a quick introduction about myself and my professional life. I am a public health program coordinator with the California Department of Public Health. I'm also a current MPH candidate with Boston School of Public Health in health equity. And so health equity and SDOH are pretty integral in my life in many areas. As I said,
I'm literally not going to leave.
So as I said, as I kind of mentioned before, we'll explore how factors, social determinants health, which are in factors like economic stability, access to health care, and even how the environment shape students' ability to attend school consistently. And we'll also dive into why the public health perspective can be really helpful when exploring a topic like school absenteeism. Next slide, please. Great. So I just want to give a quick overview of today's presentation. First, I'm going to walk through the social determinants of health, what they are and why they matter. I often refer to them as SDOH. It's pretty interchangeable. Social determinants of health is a mouthful. So if you hear me say SDOH, know that that's one and the same. And then I'll start discussing how a public health perspective can help address school absenteeism. And then we'll dive into some of the specific SDOH challenges that San Bernardino County faces. And then I'll focus on the areas of economic stability, access to quality education, and access to healthcare. And as a brief aside, I just want to let you all know, I used a lot of the data from the San Bernardino Public Health Department Community Health Assessment Report from 2024. It's a really, really thorough report, and it breaks down the overall community health of San Bernardino County. And I think it offers a really high level snapshot of what's going on throughout the county, to really start thinking about systemic change when we're thinking of a challenge or a problem such as school absenteeism. And then we'll touch a little bit at the end on racial disparities and some potential action items that, some suggestions. Throughout the presentation, please feel free to jot any questions down. If you want to raise your hand, or I think there's a couple people monitoring the chat, please feel free to stop and ask me questions, and we will pause for discussion questions. Great. Next slide, please. Okay, so understanding SDOH. We're going to start by explaining what SDOH social determinants really are. According to the CDC and the World Health Organization, SDOH are the non-medical factors that influence health outcomes. These are conditions where people live, work, grow, and age. And as I alluded to before, they include economic policies, social norms, and political systems that really shape our daily lives. An example would be to think about someone that's living in a neighborhood with poor air quality or that has limited access to nutritious food or grocery stores, or maybe they have an unsafe housing condition. All of these factors really directly affect that individual's health, even more so than their genetic predispositions or their actual access to healthcare or a healthcare provider. And so the social determinants of health are really the broad aspects of our everyday life that can affect our health. The Healthy People 2030 report initiative identified 5 key areas of SDOH, and that's really what most public health practitioners are focusing on at this time. And that's economic stability, education access, healthcare access, the social context, and neighborhood environments. So these factors don't just influence health outcomes, but they also play a role in whether students can attend school regularly. And I think we'll kind of explore that as we go on. And beautiful, this is a visual image that I wanted to just add in here. I think some people might be visual learners, but this is a very commonly used image in the public health world, I believe. It's from the CDC. If you want to keep it, if you want to have it somewhere it's accessible when you're thinking about social determinants of health, it does identify those 5 tiers that I spoke about earlier. Great. Next slide, please. So why are social determinants of health so important? Research shows, like I said before, that the SDOH have a far greater impact on health than genetics or access to healthcare. And there's a lot of different numbers, but it can safely be said that SDOH accounts for 30 to 55% of health outcomes. And so that's a really significant part of a person's life. 30 to 50% we're talking about. And what's more is that these determinants often create health inequities, which can be explained as unfair and avoidable differences in health systems that can be seen at the local level, county level, state level, and even nationally. Another example in this situation would be if we see that people living in poverty generally have worse health outcomes, including a shorter life expectancy. And that's not necessarily due to biological differences, but rather those social factors such as unstable housing or maybe fewer job opportunities, low access to quality food. All of these things can have a large impact. And these inequities are deeply embedded in our society, especially among communities of color. And those communities continue to experience the effects of these centuries of systemic racism and other systemic inequities. And so by addressing these social determinants, we can really work towards health equity, which is a state where everyone has the opportunity to achieve their best possible health. And we'll discuss how improving these social conditions is key to reducing school absenteeism, right? It kind of seems like a far-fetched idea, but I think we can make the connection. Next slide, please. This is one of my favorite images used. If anyone has ever been to a conference or been part of a discussion around inequity and equity and equality, they're really catchy. They're big catchphrases right now. Equity is everywhere. Health equity is everywhere. I think the COVID pandemic really brought that to light. But this image in particular, I believe, really shows the 4 areas that we really talk about and that I think public health and a systemic approach really takes to solving some challenges such as school absenteeism. So if you see at there's equity which is very distinct and different from equality. Equality in the bottom left quadrant, um, it requires that every person or community receives the same exact resources and opportunities. So you see here that both individuals receive the same ladder, right? So that's equal. But equity, which is in the upper right-hand quadrant, acknowledges that everyone doesn't start from the same place in life. And so they are needed, they need to have some additional support. And so you see here that there's an individual that has been given a taller ladder to reach the tree, right? And so that's the idea of equity. So people in communities have been differently impacted by a wide variety of circumstances and structurals and those historical contexts I talked about that have left some communities more disadvantaged than others, and which requires a different allocation of resources and opportunities to bring this to bring this concept of equity to fruition. And so as we acknowledge all of this, right, we're acknowledging the fact that there's a need to reach for health equity. We can take it one step further, and that's justice. And that's in the lower right-hand quadrant. And that embraces these requirements that health equity recognizes, that we need to really reach we need to provide additional resources, reallocate resources to specific populations to provide opportunities for all. And so in the bottom right-hand quadrant of the justice, it requires repairing and transforming circumstances, structures, context, and systems themselves. So they achieve and sustain equity and justice through proactive and preventative measures. And so in this case, you can see that there's been like some supports added to that tree so that it stands a bit more upright and that fruit or those apples are a bit more evenly distributed, and both of the individuals in the photo or the image can access the same resources. Great. Next slide. I think this is time for some discussion since I kind of went over the concept of equity and equality and justice. I want to kind of open it up to the group here with how do you interpret health equality versus health equity? And I think we can just come off mute, raise your hands. Or put it in the chat too.
I could jump in. This is
Sure.
Addison Science. Yeah. So as far as the first question, how do you interpret health equality versus health equity? I kind of think of it more as we're just trying to level the playing field for all people, right? So we're talking about giving them the same conditions needed to advance in a certain environment. So I really like the graphic that you had of the picture where it's like equity is, someone gets a higher ladder than the other, but the tree's not fixed. So that was great. But I think like when we're talking about just equity in general, I'm thinking just making sure people have the same conditions to be able to reach the same goal.
Excellent. Thank you for being brave and coming off mute. I think that's a great interpretation. And I see also that Penny in the chat said instead of reduced lunch prices for children, the fact that in California we give free lunch to all children. And Penny, are you suggesting that might be a justice, like a health justice perspective, kind of giving it universally fixing the system, thinking of ways that we can fix the system and not just the individual?
Exactly. It's like straightening the tree, your lower right quadrant. It's
Mm-hmm.
changing the dynamic so that all of our students have that benefit.
Excellent. Love that.
I'll also speak up. I think
sorry.
when talking about justice and how it plays a role in the educational system is, for example, making sure all schools have STEM labs. They all have access to music programs. It's not based on funding that a certain district or school gets. All of these schools should have equal access to all of these programs and tools, and it shouldn't be based on, I don't know, demographics and like why some schools and districts get more funding than others. That is an issue that needs to be addressed.
Excellent point.
I could also jump in, Janine. From a health standpoint, I know in our rural community, there are some patients that all of them that are coming to a federally qualified health center may have Medi-Cal, for example, but those with Medi-Cal don't all have transportation, for example. So one way that we can kind of make that more equitable is to provide our transportation service, bring them from their home to the clinic, because otherwise they have the insurance, but they can't get to the appointment.
Yep, absolutely. Excellent point. Great. Well, I appreciate the input. And we will dive into these areas a bit more. So if at any time anybody wants to add some insight, especially as it pertains to San Bernardino County, by all means, please feel free to jump off mute or raise your hand as we continue to kind of dive into San Bernardino County. I think we can move on to the next slide.
Okay. Yeah. So I have to go back and sign all these.
Okay. Let's see. So so why should public health professionals care about school absenteeism and school productivity? Generally, we think, well, isn't this just an issue for educators? I think yes and no. I think public health plays a critical role because absenteeism and school performance isn't just a school issue. In the long run, it really is a health issue. And that's really what we kind of explore with the social determinants of health. You know, from a public health perspective, we are looking beyond individual behaviors and we're asking, what are the systemic, environmental, and societal factors that are driving absenteeism? What is it that's happening in this specific child's life, or maybe in their community, in their neighborhood, in their zip code, in this school, depending on what level you're looking at, and identifying the root causes. And by identifying those root causes, then we can help create solutions and interventions that go beyond just the individual student or just beyond the classroom. We start thinking bigger about community interventions. This approach enables us to develop, just like I said, those interventions that address the broader social determinants that affect all student experiences, such as family income, their household living situation, the safety of their neighborhoods, or access to medical care, which I think somebody mentioned about providing that transportation to those medical appointments. Great. Next slide, please. So I just wanted to introduce the social ecological model and social determinants of health as we kind of talk about this big perspective, this high ground perspective that public health comes at when we are trying to solve an issue, right? And so when we're looking at social determinants of health, when we're trying to see what is happening, why is a certain student or group of students or particular population missing school so much, or why are they not achieving graduation? This perhaps can be a model that's useful. We refer to it often as SEM. It's a guide for developing and understanding determinants at the different levels. It's used to help design effective public health interventions, but I think in this case, it could certainly be used to think about any other type of interventions within the school education system. And it's used to inform thinking about specific and particular health problems. So you can see here that the different levels are represented. There's the individual level. These individual actors can be patients, they can be the healthcare providers themselves, or in this case, it can be students, teachers, parents, and even school administrators at the individual level. The interpersonal actors usually include something like a student-teacher dyad or some kind of combination of players who interact with each other at an interpersonal level. And then at the community institutional level, actors can be community leaders, maybe those are cultural leaders or religious leaders, community health workers, other people that play a larger role in the community. And then society and policy. And these actors can include members from the community who also might serve as policymakers. This area can kind of interchange a lot, society, policy, and then community, institutional. But these are community members who might be responsible for enacting change. So this might be something like PTA, right? There's like the PTA might kind of switch in between this community and institutional and the society and policy. Maybe they can be the ear that speaks to lawmakers, either locally or within the district. And so there's all these players that have a role here when we're thinking about interventions and how we can really address the school absenteeism. Next slide, please. All right, so now let's really fully connect SDOH and school absenteeism. So education, as I mentioned earlier in the presentation, is itself a critical social determinant of health, right? It was identified in those 5 factors. Access to education is one of the key players in an individual's health outcome, in their long-term health outcome. So education then is both an outcome and a driver of future health, but it's also a result of intervention. So an example might be students who miss school frequently would tend to have poor educational outcomes, which then limit their job prospects. And then that leads to lifelong health disparities, right? Maybe they are then having to work in a less safe environment. Maybe they have poorer access to health, all different kinds of factors. So this is really cyclical, that education and social determinants of health really feed into one another. And so I think the catch here is that many of the same social determinants of health that drive health inequities, such as poverty or unsafe neighborhoods, are also the root causes of school absenteeism. So say a student who lives in an unstable household where there's not enough food on the table, or who feels unsafe walking to school, they might be more likely to miss school for some reason. I think sometimes, like, if you really want to go down I guess you could call it a rabbit hole, but when we're thinking of situations like even health access, if there's a household that there's maybe a lot of younger siblings and a parent has to take one of the other siblings to a medical appointment, then maybe this student who is missing school because they are having to stay home to care for younger siblings while the parent takes the child to a healthcare appointment. And again, that feeds into like this lack of transportation or access to childcare, and really an access to healthcare that works for all of the community, for individuals that have different levels of access and resources. And so I think this really just, like I said, it creates this cycle. The poor social conditions lead to absenteeism. Absenteeism leads to poor education outcomes. And then, of course, of poor education outcomes, that leads to a potential worse long-term health outcomes. And so breaking the cycle is the main goal of the intervention here that I think that your team is really looking into addressing. Next slide, please. All right, so now that we've covered all of the social determinants of health, I know it's a lot of information and it might be repetitive. If y'all are familiar with that, then I apologize, or if it's just a refresher, I hope that it's useful. But as I alluded to in the beginning of the presentation, I really took a deep dive. I am not a resident of San Bernardino County. I live in Sacramento County. But in order to really bring this topic to light, I did some investigation and I found a really, really thorough community health assessment on the San Bernardino Public Health website. It's a 2024 health assessment. And they also have an improvement plan for 2024 to 2029. And most LHJs put these together on a regular basis. It's usually part of grant cycles, and really it's like a report card for the county. And so I've gathered some information from there that I think will be helpful in understanding the situation in San Bernardino County as maybe y'all start to look forward when you're thinking of interventions or ways to address absenteeism as it relates in San Bernardino County. So again, I just want to you know, I'm not the expert on San Bernardino County, so this is data that's statewide and it's available for your use, but perhaps your lived experience in San Bernardino County is different. So we'll see what story this tells. And thank you. Yes, Karen just put the link for the health assessment in the chat. We uploaded it. It's lengthy, but I find these fascinating. So, like as I said, I relied heavily on that 2024 Community Health Report. So like in many parts of California, San Bernardino County does face significant challenges when it comes to social determinants of health. It has a hardship index score of 68.6, which is significantly higher than the state average, which is 56.8. And that score reflects how economic conditions, housing, and healthcare access affect the well-being of residents. It shows that there's wide disparities in income, access to quality education, and healthcare services across different communities within the county. It's a big county. I've worked with it in several programs. So, you know, there's differences throughout the county. And the inequities contribute to, can easily contribute to chronic absenteeism and by extension to long-term health disparities. So another interesting point that I caught right away is that the county's high poverty rate and environmental risks, like the air pollution and extreme heat, are also additional factors that negatively affect students' attendance. Next slide, please. So we're going to break this down into those 5 areas that I talked about before, of those 5 social determinants of health, those key elements. And the first one is the economic stability and how that affects school absenteeism. The median household income in San Bernardino County is $70,287, which is significantly lower than the state average of $84,097. What's more alarming is that nearly 17% of children in the county do live in poverty, which is higher than the statewide rate. So this might be news to you all, this might not be, but it's just what the data and the numbers show. So economic instability has the ability, it manifests in various ways. So some examples, and we touched on this earlier, might be that families experience housing instability or food insecurity or lack of access to transportation. And those directly affect whether students can make it to school or if they can function at their highest level because they're might be hungry or they might be sleep deprived. There's all of these underlying conditions as a result of the economic instability, such as hunger or malnutrition that could hinder their ability to focus and engage in class. And as we know that, as a student becomes less engaged and maybe they feel less confidence in responding, then their goals and their desire to return to school can be affected as well. I see a chat. Median household income and poverty rates in the is it Morongo Basin are worse than San Bernardino County. Yeah, there's definitely a difference between zip codes, but I think that's true of most LHJs. We call them LHJs at the state local health jurisdictions at the county level. Next slide, please. And so I mentioned that hardship index before, and that San Bernardino County is at 56.8 68.6, with the California being at 56.8%. And so I just wanted to show this graphic. If it's helpful for any of you, the hardship index, it uses data such as unemployment, education, per capita income, crowded housing, and poverty, and they incorporate all of that. They ball it all up into a single score that allows geographies to be compared, and that's where this number comes from. And this index is it's very highly associated with other measures of economic hardship, such as labor force statistics and poor health outcomes. And as I mentioned, the scores before. So I did notice that we talked about zip codes within San Bernardino County, the Lake Arrowhead zip code of 92371 and 91748 had the lowest score of 12.8, while the actual city of San Bernardino, zip code 92401 and 92415, have the highest score at 96.1. So depending on where you work and your experiences in San Bernardino County, you might be faced with some of these hardships a bit more than others. Next slide, please. This is just one more visual, and I would encourage y'all to take some time and look at it either on the slide deck or through the report. But there's the question, there was a survey that was sent out between 22 and 24, where respondents were asked to indicate how often they lack money for living essentials. And the response options were every month, sometimes, and never. And so you can see here those individuals who identified as persons of color, their answers were quite different than those respondents who did not identify as a person of color. All right, next slide, please. Great. So moving into the education access and quality factor of social determinants of health, San Bernardino County shows that 70% of students are eligible for free or reduced price lunch, which is a marker of economic hardship. And this percentage varies widely between districts. So some are as low as 36%, while others have a higher rate of 88%. The schools that serve lower income neighborhoods often lack resources to address chronic absenteeism. So here we see a major connection, I think. Students who are in these areas in the schools maybe where they have the higher rates of reduced lunch eligibility, tend to have, they might not have as much access to school counselors, to mental health services, or even the safe environment to study. And so if we're really serious about reducing absenteeism, then it might be important to look at capacity and building internal capacity to ensure that every school has the resources it needs to support its students, regardless of the neighborhood's income level. And I think someone alluded to that with the STEM laboratories or the science laboratories. Yeah. Okay, I think next slide, we'll do a couple more slides and then I kind of want to open it up for some discussion. I see. This is just another really great graphic. A lot of this information comes from the state of California. All of the departments do have really great databases. This is from the California Department of Education. I know in my department, which is Department of Public Health, but in my division of maternal child adolescent health, it's a really great space to pull data sets from if you're ever interested. And so this chart really shows that among students who did not complete high school, 8.9% are considered socioeconomically disadvantaged, followed by foster, which is at 5.6%, and then homeless at 2.1%. And then graduation rates among migrant, foster, and homeless students were significantly lower compared to other students. So just kind of some more information. And this data is from 2021 to 2022. So I think granted, this was when we're just coming out of the pandemic. So, when they redo any kind of data sets in the next coming years, it may or may not change. But nevertheless, I think it's just important to look at. Next slide, please. Okay. The next area we were just going to review. Oh, I'm sorry. One more. This is just one more visual I wanted to share with you. I won't really talk much about it, but it does show the different absenteeism reasons based on racial and ethnic groups. So really, I think as educators or individuals who work in the educational field, maybe you can pull you can infer whatever you want from this data, but you can see that there's definitely disparity between racial and ethnic groups and their excused versus unexcused absences. And that would probably help guide policymaking or interventions regarding school absenteeism. Okay, next slide, please. Great. So one of the other factors that we were going to cover was healthcare access and school attendance. In San Bernardino County, 8.5% of adults are uninsured, and that is higher than in certain communities, especially in Hispanic and Latino residents, which is right around 11.1%. When children don't have regular access to healthcare, chronic conditions such as asthma, obesity, or mental health issues often go untreated, leading to more frequent school absences. And then the county also faces a shortage of healthcare providers, which makes it harder for families to get the care that they need when they need it. Expanding access to health services, particularly in those underserved communities, is critical for reducing absenteeism. I know in the world of public health, we talk about childhood asthma a lot, and I believe there's quite a high rate in San Bernardino County. And as we probably know, if asthma flares up, then a child is less likely to attend school that day, or for a period of days, maybe if the air quality is poor, um, and they're unable to access health care. Um, Families also may seek care in emergency departments rather than going to visits at a primary care doctor, which really has a trickle-down effect on the family's well-being. Those ER visits can take a toll on the family. They last longer. Again, maybe this is a situation where a child is having to stay home and care for other siblings while the parent is in an ER, and sometimes those ER visits last long. So there's many different facets on this access to healthcare and school attendance. And then the one more slide, if you want to proceed, it just breaks down, um, it really breaks down the ratios of the number of providers in San Bernardino County, and compares it through to California, to get a really just high level overview. So the ratio of people to healthcare providers is a measure that's commonly used to assess the availability of healthcare services within particular regions or communities. It's an indication of the relationship between the number of people in a population and the number of healthcare professionals that are available to serve them. But what's important to note here is that the provider ratios do not calculate access to culturally and linguistically responsive healthcare. So that's really important when we're thinking of students who may come from homes that are not English speaking or maybe have different cultural practices around healthcare. And so this provider ratio data does not identify whether people have access to healthcare that aligns with their cultural or behavioral or communication needs. So generally speaking, the lower ratio suggests better access to care, while the higher ratio can indicate potential challenges in accessing healthcare services. And then the next slide, I think we're going to open up the floor for some more discussion. And I would just love, I've been talking a lot, and so I would love to open the floor for anyone's answers to these questions, which is how do you think access to healthcare plays a role in chronic absenteeism? And what are your districts currently doing to address the healthcare access?
So I'll go first again.
Great,
to
thank you.
break
As
the
I know
ice.
it's after lunch. It's tough. Thank you.
Yeah, so I think so how do I think access to healthcare plays a role in chronic absenteeism? Well, like you had mentioned, I think one of the biggest things is that if there is a lack of health care or access to health care, I think that that plays a big role. So I'm just thinking of somebody, for example, maybe you have I'll think of a dentist, right? You have students who might have a cavity, their teeth are hurting all day. They're not feeling well, and they can't focus. So mom or dad or parent guardian stays home with them. So that contributes to that. So I'm thinking that if you can't take care of the most basic things like preventative medicine checkups that allow you to essentially catch a lot of these things early on, which may prevent you from being absent later. I think that's how you can affect it, because rather than being absent one day for that preventative checkup, now you're going to be absent for multiple days because of the pain that you may be experiencing. Plus, now you're taking that day for the doctor's visit and any other follow-up visits because you waited so long. But the nice thing is, I work for the county. However, I know that through our department, we're working with a lot of school districts on seeing implementing things that we can do to address healthcare access, and that one of those things being the school-based health centers. I know that as a lot of our team members are part of the California or it's the health school health alliance, so we work with them and trying to bring a lot of these resources to our schools, because we know what we know in education is anytime we refer parents or community members out, the the actual follow through is almost non-existent. So what we do is, if we can say, well, your kid's already here, we have a dentist that can check for cavities and can tell you, hey, yes, your child does need to go see a dentist to get these things filled. So then now it's kind of like a referral. Now the parent, looks at this thing and says, okay, I got to take care of this now. So I think I think our school districts are working. I know there's a lot of work to be done, but we're making headway in seeing ways that we can bring these different forms of healthcare to the schools themselves for the kids and also the community members as well.
Thank you, Addison, for that really thorough response. And I understand that y'all are in the process of building these health clinics, which I think is that in my opinion, if we're thinking about how to make a systemic change, that's a perfect example, right? It's not addressing one child's absenteeism. Let's look at what's going on in the broader picture, and how can we approach the students' health, the student population health as a whole, rather than just focusing on the individual. That's wonderful. I see a question. Do we have access to studies that show how some cities took action and reduced chronic absenteeism significantly? I don't have the answer to that right away. I'm sure there are studies. Are you talking about cities within San Bernardino County? Or is that a question that y'all are posing? I'm not sure. Okay, well, I think that's something to look into, definitely at the county level. And there is a lot of information, as I said, on the Department of Education website. The State Department of Education does have dashboards that you can pull data from based on zip code. And if you were to, for example, if you wanted to look at specific zip codes that are in a particular city, if you know of a city maybe that has had a better school attendance rate, maybe deduce from that data, go to the city council members and see what they did, what those districts did. But again, a lot of that data is available on the California Department of Education website, but also I would imagine local data is available at the county level. Does anyone else have any input? Okay, let's go ahead and we don't have much more time, so we'll just jump through a couple last slides, and leave time for questions and answers. So I think I just wanted to touch on neighborhood environmental impacts, which I know I talked about a bit before as well. But neighborhood and built environment is another one of those key factors that we want to think about when we're thinking about how we can change school policies or district policies to improve school absenteeism or school attendance. And that includes factors like housing quality, transportation, environmental safety. San Bernardino shows that there's, a slightly higher violent crime rate than the state average. But I think more importantly, or maybe what stands out, at least as this report shows, is that environmental hazards also play a significant role. San Bernardino has twice the state's average levels of air pollution. And that poor air quality again leads to respiratory issues, which might then contribute to higher rates of absenteeism. And also the county is now starting to experience more extreme heat days, which are projected to increase as climate changes. And that also further affects health outcomes and school attendance. But I think that's being felt statewide. I know Sacramento this year, I think this summer had like a whole month of 110-degree temperatures. It was outrageous. I didn't think summer was ever going to end. And so it's just bringing it back to the concept of where we are born, where we live, where we learn, where we work, play, and worship. These all significantly impact our health and our well-being, and then affects the ability to go to school on a regular basis and succeed in school. Next slide, please. This is just a high-level overview of racial disparities and absenteeism. The data shows that African American students in San Bernardino County have unexcused absence rates of 44.9% compared to 36.5% for white students. And these disparities reflect back on those broader systemic and inequities that we kind of spoke to in the beginning, which include structural racism and possible discrimination in schools. And so the reason I bring this up is really from an equity perspective, and from a social justice perspective, is that, when we're thinking of reducing rates of absenteeism, it's important to stay equity focused and have equity focused interventions that really address the unique challenges posed by these historical situations and that are faced by students of color and different racial and ethnic groups. This might include interventions that are culturally tailored to support services, for example, maybe improving access to healthcare in minority communities and addressing implicit bias in school discipline policies. So those are just some ways that I have heard of thinking about school policies addressing absenteeism in different racial and ethnic groups. Next slide, please. This is, again, just another data set, which I think I spoke about earlier, that you can go in and pull, but it shows you can pull days absent from school based on a variety of factors, and I think you can break it down by zip code as well. And so if you're really interested in pinpointing a specific area, this data set is open to the public. It does take some time for it to think and work, but it's there. The data is there, and you can always put in an information request as well. Next slide, please. All right, so you know what now? I mean, I'm not really here to provide any kind of, I'm just providing insight and from kind of a public health perspective, some areas of potential improvements or potential interventions from a public health perspective as it pertains to school absenteeism. So first and foremost, we talked about how economic instability and limited healthcare access, unsafe neighborhoods were some of those main factors driving absenteeism in San Bernardino County. But we also see that those factors disproportionately affect low-income families and communities of color. And so what do we do about that? Well, I think that, of course, enhance economic support for families by increasing enrollment in public assistance programs. Some of those public assistance programs are there and just not accessed because maybe there's barriers that a family has to understanding how to apply for that, or maybe not even knowing that they're eligible. Expand healthcare services, particularly in underserved areas, and ensure culturally responsive care. And it sounds like Addison alluded to some really great programs that are happening to expand those healthcare services. Investing in safe environments by addressing environmental hazards and improving neighborhood safety. And then addressing racial disparities by implementing those policies that target the needs of marginalized communities. And so I think if communities work together through partnerships, if education, public health, healthcare services, it takes a village, as they say. And I think that there's a real need for breaking down these silos of I'm just an educator, or I'm just a public health professional, or I am strictly a clinician. I think really there's a lot of work that can be done in breaking down these silos to address school absenteeism and long-term school success, because with school attendance, the student is more likely to achieve success. I think if you want to I just wanted to revisit the different levels of intervention that we discussed before, just as a reminder. And then I think the next slide. So just kind of wrapping everything up, social determinants of health are essential for tackling school absenteeism, right? To really think of it all as one whole concept. It's not just an issue for educators, it's a public health issue. By improving social conditions in which our students live and learn, we set them up for success, not just in school, but in life, and we create better long-term health outcomes. And as I mentioned before, it's really going to take a collaboration between healthcare professionals, educators, community leaders, and policymakers at the local level, city level, state level, county level, all the way up to the top. But I think the benefits are really big. I think the potential benefits of this collaboration are always growing. And I think more and more, as I said in the very beginning, like health equity has come to the forefront of a lot of people's vocabulary. And I think equity is becoming more widely discussed. And there's a chance now, there's a little open window for some community action and some community involvement to really provide the most equitable services to students and to the community at large. And then I think my last slide is just a quote, just a fancy quote. Health is more than the absence of a disease. Health is about jobs and employment, education, the environment, and all of these things that go into making us healthy. So that's it. If you have questions for me or for anybody else, I'll put myself on mute. I think I've talked quite enough. Thank you.
All right. Do you guys have any questions for Casey?
So I do. Sorry, I know
Yeah.
I've been talking a lot in this webinar, but I really love this information. So I had a question, and I've seen so many different not conflicting, but different answers to this online. So I figured I'd ask. Do you by any chance know what is considered the poverty rate for California?
I don't have that off the top of my head. I would have to pull it, but
Okay. Yeah, I just was looking online. I was like, I see this number and I see this number, so I was just trying to see if maybe it's in that ballpark. So thank you.
mhm.
Any other questions? I do see in
I
the chat.
don't
Oh, go
have a
ahead.
question, but I just want to chime in. I work with Addison, but we have previously worked in policy at the local level, and I really just can't, or we don't ever stop talking about how important it is for districts and schools to really start talking with their city council members about policy and how cities really need to start looking at not just the economics, but the health of their community, because those go hand in hand. And really, the schools cannot do this work alone. Health will never be improved in the school systems without the cities also being aligned with those same goals and adopting environmentally friendly economic policies, health friendly economic policies. For example, in the cities of San Bernardino, we have the highest ratio of alcohol outlets in our city compared to any other city in San Bernardino County. We have a lot of marijuana dispensaries. Those two things alone increase access and use of drugs among our youth. And yet schools are the ones that are really filling some of the initial repercussions of those policy decisions. That's where it's starting. That before it even gets to the city police having to deal with students, it's the schools that are having to deal with the use at the school system. And then once they age out of the school system, then it becomes more of a city issue. But it's really both of their issues, the city, the community, the schools. So I just want to put a plug in for how important it is not just to look at the public health department, but the city council when we're trying to work on making healthier schools and school systems.
I've got a question. I'm Geddes Mohammed with the PAL Charter Academy. Is there any education materials for social determinants of health that we can use with our students to share this type of perspective to students and help them understand what's going on in their community? And then it's geared to high school students.
Well, if that's a question for me, I'm not one that's in charge of curriculum, so I'm not sure if that would be posed to me, Marwa, or if you were.
Yeah,
Yeah.
I was going to answer. So,
Yeah.
we don't have here at the county office any educational materials on the social determinants of health specifically for students. But that's something we can definitely look into Getty's and share with you if there's any that's out there, because I'm sure there's a lot of resources and materials out there. We just have to find them, and then we can go ahead and provide you with that information.
Thank you. Thank you so much.
Any other questions for Casey? Okay, well, I noticed in the chat, Penny put community schools, which is the perfect segue for our next webinar, because it's going to build off of this webinar. So many of you guys are a part of the community schools initiative, so we will have somebody from the RTAC come and speak about community schools and how it connects and aligns with the social determinants of health. So that will be in March. I'll be sending out a flyer with a confirmed date and registration link as well. So just be on the lookout for that. But with that being said, if you guys don't have any questions, we'll go ahead and put the live binder in the chat along with the feedback survey. If you guys can take some time to complete that. And then I also want to thank Casey for your time and just this opportunity that you were able to provide to this LEAs and other community-based organizations. So with that being said, we'll go ahead and end the meeting, unless you guys have questions.
Thank you all for letting me come and sit in San Bernardino County virtually.
Thank you.
Thank you so much.